It starts with a cough or sneeze from the crib, a tiny sound that instantly grabs your attention, even in the middle of the night. You pause, listening closely, heart beating a little faster as you wonder if it's just a passing tickle or the start of something more. Suddenly, you're on high alert. Every cough, every whimper seems louder and more urgent in the quiet darkness. You find yourself straining to hear, ready to jump up at the slightest sound. You check your baby's forehead. Maybe it feels a little warm, maybe there's a low fever. You reach for the thermometer, hoping for reassurance, but still feeling that nagging worry in the back of your mind. Is it just a cold, or could it be something more serious? The uncertainty can be overwhelming, especially when your baby can't tell you exactly how they feel. Every sound is amplified at night, and you wonder if you're overreacting or if you should be doing more. The responsibility feels heavy, and sleep is hard to come by. You try home remedies, adjusting the room temperature, running a humidifier, offering extra fluids, and making sure your baby is as comfortable as possible. You remember advice from friends and family, hoping these small steps will help. But in the back of your mind, you worry about RSV and other illnesses you've heard about. You search online, looking for answers, trying to figure out if your baby's symptoms match what you've read. Knowing what to look for is key. You watch your baby's breathing, check for signs of distress, and pay attention to any changes in their behavior or appetite. You know your baby's normal sounds and habits better than anyone else. You notice the little things, a different cry, a new cough, or a change in energy. By learning about RSV and other common illnesses, you're adding valuable tools to your parenting toolkit. You read, you ask questions, and you seek advice from experts when you need it. You don't need to be a doctor, just an expert on your own child. Your intuition, combined with knowledge, is a powerful combination. This guide will help you spot the difference between a simple cold and something more serious, giving you the confidence to know when to seek help. Trust your instincts. They're your best tool. If something feels off, it's always okay to reach out for support. Let's learn how to protect your little one so you can rest a little easier, knowing you're prepared for whatever comes your way. RSV, Respiratory Syncytial Virus, is a common but often underestimated virus that affects people of all ages, all around the world. It's a member of the same family as the viruses that cause the common cold, but RSV can be much more severe, especially for certain groups. This virus primarily targets the lungs and airways, making it a leading cause of respiratory illness in young children. Each year, RSV sends thousands of infants and toddlers to the hospital, especially during the colder months when the virus is most active. For most adults and older children, RSV infection feels like a particularly nasty cold. Think runny nose, cough, and mild fever. Recovery is usually quick and complications are rare. But for infants, especially those under 6 months old or born prematurely, RSV can be much more than just a cold. Their immune systems are still developing and their airways are tiny and fragile, making them especially vulnerable to severe symptoms. In these little ones, the virus can cause the airways to swell and fill with thick mucus, making it hard for them to breathe. This can quickly become a medical emergency, requiring close monitoring and sometimes even hospitalization. RSV is highly contagious and spreads easily through tiny droplets from coughs and sneezes, as well as by touching contaminated hands, toys, or surfaces. Daycares and crowded places can be hot spots for transmission. Babies are especially at risk because their bodies haven't yet built up strong defenses against infections. Even a mild case in an adult can be passed to a baby, leading to much more serious illness. When RSV infects the smallest airways, it can cause bronchiolitis, a condition that leads to wheezing, rapid breathing, and sometimes a bluish tint to the skin from lack of oxygen. These symptoms can be frightening for both parents and children. Nearly every child will catch RSV by the age of 2, but the first year of life is when the risks are highest. That's why it's so important to recognize the signs and take steps to prevent the spread. Simple actions like frequent hand washing, cleaning toys, and keeping sick children home can make a big difference in protecting your baby from RSV. By staying informed and taking precautions, you can help keep your little ones safe. Awareness truly is your best defense against RSV. RSV, or Respiratory Syncytial Virus, often begins just like a regular cold in babies. You might notice a runny nose, a mild cough, a low-grade fever, or your baby being a bit more fussy than usual. These early symptoms can be easy to overlook, especially during cold and flu season. but it's important to pay close attention to how your baby is feeling and acting. Most babies with RSV recover at home with rest, fluids, and lots of cuddles. However, it's crucial to watch for any signs that your baby's illness is getting worse or that they're having trouble breathing. Listen carefully for a deep, wet-sounding cough or wheezing, a high-pitched, whistling sound when your baby breathes out. These noises can mean the virus is affecting your baby's lungs and airways. Count your baby's breaths while they're calm and resting. If you notice your baby is breathing more than 60 times per minute, this is a red flag and means your baby may not be getting enough oxygen. Watch for signs that your baby is working extra hard to breathe, like chest retractions, where the skin pulls in between the ribs, nostril flaring, or head bobbing with each breath. These are all signs your baby is struggling and needs help. If your baby seems extremely tired, unusually sleepy, or has trouble waking up for feedings, this is serious. Babies who are too tired to eat or who can't stay awake may be getting sicker. If your baby refuses to eat, seems very sluggish, or just isn't acting like themselves, don't wait. Call your doctor right away. It's always better to be safe and get professional advice. Trust your instincts as a parent. If something feels off or you're worried about your baby's breathing or behavior, seek help immediately. You know your baby best. Early action can make all the difference in keeping your baby safe and healthy. Doctors can help you decide what to do next and provide the care your baby needs. Stay alert, know the warning signs, and don't hesitate to reach out for help. Your attention and quick response can help your baby recover faster and avoid serious complications. Some symptoms mean you need help right away. If your baby's lips, tongue, or skin turn blue or gray, call 911. This is a medical emergency. Severe trouble breathing, constant retractions, or pauses in breathing, apnea, are urgent. A high fever in a baby under 3 months, over 100.4 degrees Fahrenheit, 38 degrees Celsius, needs immediate attention. Rapid, shallow breathing that doesn't improve is a red flag. Watch for dehydration. No wet diaper in 6-8 hours, dry mouth, no tears, or a sunken soft spot. These signs mean your baby needs medical care now. Don't wait. Trust your instincts and act fast. Your quick response can save your baby's life. Most mild RSV cases can be managed at home. Use saline drops and a nasal aspirator to clear your baby's nose before feedings and sleep. Run a cool mist humidifier to ease breathing. Clean it daily. Offer smaller, more frequent feedings to keep your baby hydrated. Never give over-the-counter cold medicines. They're unsafe for infants. Antibiotics won't help. RSV is a virus. Focus on comfort, suction, humidity, and hydration. If symptoms worsen, your baby may need hospital care, oxygen, IV fluids, or advanced breathing support. Hospital care is scary, but it's the safest place for a very sick baby. Most babies recover fully with the right support. Stay calm and follow your doctor's advice. You can't avoid every germ, but you can lower your baby's risk. Wash hands often, yours and anyone who touches your baby. Keep sick visitors away, especially during RSV season. Avoid crowded indoor places with your newborn. New tools can help. A maternal RSV vaccine during pregnancy or an antibody shot, nirsevimab, for infants. Ask your pediatrician what's best for your family. Knowledge and early action are your best protection. Trust your instincts. If you're worried, call your doctor. Share what you've learned to help protect other babies too. With care and vigilance, you can keep your little ones safe and healthy.